All right, so doing my own podcast today here on Instagram. So it's going to be something I want to try and do more of when I do have the time to do so. So, first things first, my name is Dave Reyes, functional medicine practitioner, functional health coach, owner of Complete Vitality Functional Health Coaching Organization. Okay, we are now starting a medical side and everything. So, a lot of fascinating stuff, but I work with many different clients all across the country. From Minnesota, I outpatient have a practice here in Minnesota. I work with people all across the country, even outside of the country. So, what I want to talk about is that what is the difference between a functional medicine practitioner and a normal doctor, or working with a functional health coach than just like a personal trainer or nutritionist? Because many people think just it's one or the other. They think that just working with a practitioner is not the same as like working with a, I guess like a medicine type doctor. So the biggest thing is that the conventional Western medicine model, so the allopathic model, your doctor, okay, your primary care physician, your endocrinologist, they are trained in pharmaceutical or procedural care. So what that means is that their way of helping someone is through pharmaceutical drugs and medication, which is very beneficial and has its time and place, and or also procedures. Okay, removing something, maybe adding something in. Okay, and that's a big discrepancy in how something is healed and how someone can heal. Okay, so what happens is you go to your doctor. You either are there for your primary care checkup, or you are there for some type of checkup, or you're there because you have a health concern. Typically one of those three. Obviously, there's probably hundreds of different reasons why you're there, but if we made it super simple and straightforward, those are the main reasons why you're there. You have brain fog, you have fatigue, you have depression, anxiety, or you just don't feel well. So you go and see your doctor. Okay, what they're going to do is they're first going to evaluate you. They're going to do a physical evaluation. They're going to weigh you, check your heart rate, blood pressure, all these things. I know because I was there and I did it. The next thing they're going to do is they're going to pull some blood panels. Now, when they say they're going to pull some blood panels, what does that mean for you as the patient? What does that actually mean for you? No one knows. You don't know. Your family, significant other doesn't know. That's one of the most scariest things with conventional medicine, is because they're just doing things without actually explaining to you about what you're actually doing, or what they're doing rather. Because we've all heard the line of, hey, I'm just going to pull some blood work, we're going to check some things out, and then you get the results back, and then everything looks normal. And so what they're going to do is they're going to pass you on like a football to some other type of specialist. Hey, you're going to go see an endocrinologist. Or if you're dealing with gut issues, you're going to go see a gastroenterologist. You're going to go just get referred to GI. Or whatever. So, because your labs are normal. See, that's one of the biggest issues here, because like I just said, you have no idea what's going on, and they have just given you even more confusion. The second thing here is that whatever imbalance you're dealing with, the only solution they're going to give you is, like I had said, a pharmaceutical medication, which most definitely has its time and place, and I agree. I agree so much on that I actually have my own telehealth medicine clinic here that I'm starting. Okay, that's how much I agree on that. So if there was anyone that said, oh, he's against medicine, then that's wrong. The second thing here is that, though, the only solution we are giving someone is that medication, when in fact that's a symptom management. That is managing the symptoms. What happens when you take a medication is that it blocks our innate ability to self-heal and self-regulate, because it artificially induces something. Okay, that is just the fundamental mechanism of action, something called pharmacology, of what these medications do, which can be very beneficial. If I need to lower my blood pressure, let's block the mechanisms of action that increase my blood pressure, for example, and so forth. If I am dealing with an underactive thyroid, let's just give myself thyroid hormone, or thyroid medication rather. Like I said, they all have their time and place. But the thing is we're missing how the body actually works. See, we talked about it. In conventional allopathic medicine, we have specialists. Okay, we have an endocrinologist for your endocrine system. We have a gastroenterologist for your gastrointestinal system. We have a cardiologist for your cardiovascular system. And then we have a primary care physician for a generalist. The thing is that when you go see that specialist, they're just specializing in that system or that hormone in your body. They're not looking at how your body actually works in unison. Okay? Because if I deal with a thyroid issue, that doesn't just affect my thyroid and my thyroid gland. That has a systemic effect throughout my body. that can influence my other hormones, that can influence even my lipid panels. So that's like my cholesterol, my triglycerides, my LDL. It can also influence my gastrointestinal issues. I mean, having a thyroid issue can lead to gut issues and even vice versa. None of this is established or even mentioned in allopathic conventional care. This is why clients come to me, and not in an arrogant way, but they get results because we look at the body fundamentally different. How the body is actually made to heal, how the body is actually made to work in the best way possible. Now, going back to lab testing, when you're dealing with an issue, they're not even testing what, like I said, first of all, you don't even know what they're testing. And actually I know this because I just saw it firsthand. So they don't know you don't know what they're testing, you don't know what they're even doing. So a big mistake that happens in conventional allopathic medicine is that their testing is very, very minimal. They are not testing nowhere near the comprehension you deserve and what you actually need to identify what issue. Another reason why they do this is because they're reactive and not preventative. I had around 8 lab tests here today. Every single lab test I read was thankfully, 2 or maybe definitely pre-diabetic, but mainly some of them were at 5.5, 5.6, 5.4. Now, I always like to reiterate, hey, are we here to prevent things or are we here to react to things? Do you want us to react to this down the road when you are full-blown pre-diabetic, or do you want us to establish things now to start fixing it? Obviously now. Now it's important because first of all, the lab reference ranges of the conventional allopathic medicine model is for a sick population. It is sick people they are measuring off of. And each year, the confinements is getting wider and wider and wider. So what does that mean? That means that the normal ranges are getting worse and worse and worse. Statistically speaking, by the year 2030, 7 out of 10 Americans will have some form of lifestyle disease. Okay, the stats are already astonishing. Okay, 1 in 3 children have some form of prediabetes. So when they do these lab tests, they're not getting the bigger picture. They're not testing everything that's going on. This is going to lead us to a bad spiral. Okay, and I'll explain to you why here, because you don't feel well. You get your lab test. They say that you're normal, but did they even test you with the right things? Because the amount of times that I've had clients come in, patients come in, and they're like, Diego, these are the labs they ran. Obviously, I don't feel well, so what do we need to do? And the thing here is that what I'm seeing is that they're just getting a CBC done, which is great, but it's not going to measure other systemic effects. They're getting a comprehensive CMP rather is another one, so that's great to check liver and kidney function, but it's not going to show anything. Maybe they'll check a TSH, but they're not testing anything that's actually valuable in terms of like the whole picture here. Now, another thing is that they're not even testing how and what the functions are doing. And quite frankly, at the end of the day, no matter whatever they test, it does not matter because the only solution they're going to give you is a medication, okay, a pharmaceutical medication. They're not going to give you any lifestyle things to do. They're not going to give you any nutritional things to do, let alone any proper supplemental or peptide protocols for you to be used to help this. This is important because if you don't fix the root issue, then you're managing your symptoms, which is fine if that's something you want to do, which I can value, but you're still not fixing the issues of what's happening. Now, I want to hone in on a topic that's less clinical and more on the fitness side because it's also pretty invaluable because the amount of people that are over-dieting, over-training is astonishing and still not getting results in weight loss and energy and libido and everything else. Because the thing is that the fitness is almost as worse as the medical. See, this whole past 10 minutes or whatever, however long, I was talking about conventional medicine being terrible in terms of actually trying to solve your issues. Well, if I go to the other side here and I talk about the fitness center, the fitness side, so we're talking about all of the fitness stuff, personal trainers, nutritionists, definitely valuable. But do they fix the root cause? See, the thing is that for the longest time, we have kept trying to pretty much manipulate our metabolism without actually working with it. And so what I mean by that is for the longest time we've done different types of fad diets. We've done keto, we've done carnivore. Heck, we even done whole food. And we still can't lose weight. You still can't lose weight. You still have fatigue. You still are tired. You still aren't putting on muscle. You still aren't at the physique you want. Because they have failed you. It's failing people. It's failing everyone. So we have the fitness people that are getting failed. We got the medical system failing people. So now we have lost a trust. I mean, the amount of trust that's in our society right now is at the lowest that it's ever been before. It's at the lowest. Now, is it due to the internet? Is it due to politics? I don't know or care. But all I know, and just like you know, the trust is low. So we don't even know who to trust. I mean, just after recent events, the CDC, I mean, the past 5 years, FDA. Now, this is not getting any way, but what we should understand here is that we are spending more money in healthcare. We have more doctors. We have more doctors than ever before. We have more nutritionists ever before. We even have people like me more than ever before, but yet we are declining in health. The statistics show this. We are yet sicker. We spend the most money in healthcare, but yet we're the sickest country. We are the sickest country in the world. I was going to say United States, but in the world, we are the sickest country in the world, but we spend the most money on healthcare. Is it really healthcare? Is it? Or is it symptom management? Is it disease management? Can you blame it on the food in our time? Can you blame it on many external factors? Yes, 100%. There is 100% tenfold of our environment today, and then our environment in the 80s, our environment in the 2000s, early 2000s, heck, even 2010s, and now where we're at today. So what that should mean for you is that if you are dealing with this issue, you know someone dealing with any of these issues, then it ought to have a conversation to find out a different route to fix that problem. Because we all know the definition of insanity, and that is doing the same thing over again, expecting different results. So if there was one thing you could take away here, it'd be you got to get a second opinion. If there was ever a time where you have gotten a diagnosis, you've gotten a statement, or you've gotten whatever, some verbiage, and you aren't even, you're shell-shocked, you're shook by the results, I would get a second opinion. I would get a second opinion of a practitioner or provider that focuses on functional care or holistic natural care. Now, when I say holistic, we're not talking about tea tree oil. We're talking about someone who is understanding physiology, who's understanding how the body intuitively works in unison rather than isolation, like what conventional medicine does. We're talking about someone that understands this, because if you do not understand this, then you are going to be playing in circles. We all know someone playing in circles. We're getting tossed around from specialist to specialist. Okay, there's many times I've seen a lot of people in just huge distraught from the sickening of what the healthcare system has provided. And here's the thing, though, the agenda of what the doctors, or rather the medical industry is with the insurance companies. So if people ask me all the time, do you take insurance? Well, if I took insurance, do you think that if I took insurance, if I came in today and I started taking insurance left and right, do you think that will help you or me? Because the thing is that it probably would help me more than helping you, because what then I can do is I can manipulate what I can give you, because that's what the insurance does. It manipulates the care that a patient can receive. For example, if you're someone with a thyroid issue, your insurance might not cover a TPO antibody test, but your insurance could cover a testosterone reading. That is exactly how the insurance game is worked. So as a provider, what I can do is I can give you a testosterone test and be like, hey, you're right off, you're good. It's all through insurance. But is that what you need? Is that what actually is going to help us solve the issue that you're dealing with? No. And just think back for a second. If insurance was helping people, then why are we sicker? Why are we unwell? I think a lot of people need to reframe what we think about with insurance companies and health. You think I don't want it, though. I would absolutely love for my patients, my clients, to be able to use whatever they have or insurance if they do, I don't know, and be able to get the care and access they need. But unfortunately, it does not even work like that. It doesn't even work like that so much that I am training in a medical director, and I have access to all medication. We have access to all medication we ever want. And yes, we could do insurance for that, but is that medication going to be the best for the client and for the patient? Okay. Is it? Okay, we can give you this progesterone and cream, but is the progesterone capsules going to be better? Yes, maybe. So what do you want? Do you want something that's going to maybe work 40%, or do you want something that's going to work 100%? That's what you're playing with when you're trying to get nitty-gritty with the insurance stuff. And that's what happens. That's what happens with all of this alternative care. Because if insurance worked, then you probably wouldn't be sick right now. Because you've already seen the doctors. You've seen everyone, but we're not well, okay? So that's a big thing too. All right, so I want to talk about something that I do inside my coaching practice too that relates to the information that I'm speaking on here today. That's functional testing. Now, many people hear that word and they're like, what is functional testing? So if there was a specific word to speak about functional testing, just find it as more in-depth testing, more comprehensive testing that goes far beyond, or rather testing that's going to actually identify the real reason why you're dealing with the imbalance that you're dealing with. So we all know people here today that has hypothyroidism, Hashimoto's, chronic fatigue, fibromyalgia, autoimmune issue, weight gain, and weight loss resistance. We all know people here today. So yes, exactly, Kelly. And Kelly's a client. She's doing well. Insurance companies just are money like everything else. Yeah, everything is ran by money. It's a monopoly. So so might as well just make your own, right? So that's essentially what we're trying to do here. But we're actually trying to help people because we actually believe in people. We actually are ethical. We actually believe in good things. So yeah, that's huge. That's huge. That's what we're trying to do. We're trying to create an ecosystem here to actually give people the care they need and want. So that's big. That's big. Now, going into what I was saying here, the functional testing, that's a great point, Kelly, so like I said, we all know people dealing with whatever issue that's going on right now or whatever they're dealing with. So functional lab testing is going to help us identify the real reason to that. And there's a multitude of tests that we can kind of find out what is causing our problems. So like in my coaching, in my practice, whatever you want to say, is we run toxin testing, we run food sensitivity testing, we run stool testing, and many other tests, okay, so much so that it can't even fit into this video. But what we're trying to get at here with the testing is that what we see on the surface is symptoms of diabetes, chronic fatigue, weight gain, weight loss resistance, but we aren't looking under the stems, underneath what is the true reason behind your problems. And these testings and these tests are going to find them and find them for you. See, the thing is that when someone's dealing with an issue that's chronic, they're not dealing with just one thing. For example, I have people come into me all the time. This is the normal person. If you're watching this, you know this because you have chronic fatigue, you have weight gain, you can't lose the weight, you maybe have insomnia, low libido, some type of depression or anxiety, hair loss, always cold. You have these symptoms. Now the thing is that just having low hormones that I see on your blood test is not the only reason why you deal with this symptom. Just having some type of imbalance inside your gut is not the only reason why you have this symptom. It is a multitude of different hormones and systems in your body that is now exacerbated and have came up as what you are dealing with today as we speak. And that's really important to understand because the amount of people that have gotten hormone replacement therapy, they've tried this supplement or that supplement, and still do not feel well. is astonishing. And it's for that exact reason. Why? Because if they're dealing with one issue, or I should say a multitude of these issues, it has systemically affected the whole body in many different ways. And I also see this in blood testing, because not only will an individual have some form of insulin resistance, not only will some individual have some form of subclinical hypothyroidism, not only will one individual have some form of cardiometabolic issues like high triglycerides, high cholesterol, they will have all of them. Now, all of these things, all of these imbalances in one lab test showing us is the exact reason why you're dealing with the symptoms today, and it is also the exact reason why you will not get better trying to introduce one thing. Now, I say this as a preface in terms of my programming, because when I give a program to someone, when I give someone the tools that they need, they're like, holy shit, this is a shit ton. Yes, exactly. Because we just talked about it. You have 16 imbalances, and 16 imbalances is causing the 67 symptoms you're dealing with. That is important. That is important. Because if you do not establish all these imbalances that you're dealing with, you will truly never fix the root cause. Because you are not dealing with a root cause. You're dealing with root causes. Okay? That's important. So, going to the next thing here. Okay? Going to some of the real problems that clients face here with me. They deal with it all. Chronic fatigue, even with caffeine, 8 hours of sleep. They deal with weight loss resistance despite strict dieting, fad diets or low calorie dieting. They have brain fog. They have low motivation. They have chronic fatigue, PMS, low libido, perimenopause, andropause. That's another topic. I help many men. Digestive issues, so bloating, constipation, abdominal pain, burnout, high stress, emotional disconnection. Okay. You go to your doctor, they think it's all in your head. They think that you're crazy or whatever. So we fix these. And the first step we do that is by fixing the underlying reasons to why these symptoms come up. Okay. And so the thing is that there's so many times I have people, they're like, hey, Diego, I want your help. I want these testings and whatever. And I kind of look at them and I'm like, okay, you don't hire me to get lab tests done. Okay, if you need to go get lab tests done, I can get you a lab test. You don't need me. You want a provider, you want someone to help you through this, rather a coach, practitioner, whatever, to help you through this because they already understand the body. They understand what's going on. And they understand how to heal you and fix you. Now, I'm trying to say this in the most digestible, non-arrogant way because it's truly like if you thought about it as, okay, so you go see a car mechanic. Do you see the car mechanic himself or do you go see the car mechanic in terms of what company that person works for? You probably go to maybe the car mechanic or the company he works for. It doesn't really matter. And it almost doesn't matter because I don't even know what this analogy is going for. But what I'm trying to say here is that you don't need me to get the functional lab test, okay? You can go get the functional lab test yourself. It's not even about that because if you look at the lab test, you might not even know where to start. You might see you have low vitamin D, so you're gonna go grab vitamin D supplementation. But what's causing these imbalances to occur? That's the true value of having a health provider, health coach, or practitioner look at these lab values and look at this because they're able to identify the symptomology and how the body intuitively works to fix these underlying issues that are causing your problems. That is important because we've all been gaslit. We've all been dealing with chronic health symptoms. Not one supplement, not one medication is going to help you fix the root cause of those problems. It's going to take a systemic, whole body approach that targets the root cause, the underlying cause to your problems. That's what I do with my clients. Just looking at the lab test is one part of the equation. It's not even the main part of the equation. So we talk about it as like, in today's time, we have so many different variables that are influencing our hormones, our body, our immune system. one of the best things to do if you are trying to fix your health and do whatever is you have to remove the things that are making you sick. You can't heal in the same environment that made you sick. So you got to remove all of the irritants that are driving your symptoms, whether that be people, places, things, food, toxins, whatever. That's going to be the most beneficial thing. Okay. But I want to talk about another topic here that's pretty important. This is not medical advice. Whatever I'm saying here, this is all participation. This is for educational and informative purposes only. I am not a medical doctor. This is at least not a medical doctor on Instagram and meta.com. And so what I want to talk about here is something that's really important to talk about. And so I'm just not trying to get my stuff shut down, so I had to put that disclaimer there. So I want to talk about peptide therapies in terms of like what they are, what they do. So peptides are pretty important when it comes to the whole conjunction of everything I've just spoken about here for the past 25 minutes. Peptides are short-chain amino acids that our body already makes. So they're not something foreign. They're not something that is something like a extracurricular. I'll put it like that. I'm not trying to get banned here. I've already had that before. So the thing is that these have a huge role in healing, more than we ever will understand and comprehend, at least in the next 10, 15, 25 years. And so if you are here today and you're thinking about peptide therapies, I would love an open conversation between you and I have many different videos out there. I can't really speak on that on Instagram. I'm not having that in terms of, they shut you down. You can't really speak. So, but I would say like there's many peptides that help with healing, regeneration. And the thing is though, what I see today is that people are just looking at peptides as they're just like this one size fits all. They're looking at it as they just take one and you're good. They don't look at it on how it could systemically affect, or I should say, transform and heal an individual or condition you're dealing with. So I like using peptide therapy in my practice and my coaching because it really does help people facilitate even better results in conjunction with everything else that I speak about. Does that mean every client uses it? No. Does that mean every client has to use it? No. Does that mean you get the choice to use it? Absolutely. Do I think it's a great tool? Will I recommend if need be? Absolutely. Not recommend actually. I would always say for you to speak to your provider about that. But anyway, it is a great tool. But so I wanted to just talk on these topics. I mean, if there's any questions, I know I went off here, but this is more of that podcast. So if you like this podcast deal, that's great. I would love to do more. But it's important because I think like I said, the statistics are astonishing. We're only getting sicker. People are only getting worse, and we're not getting better. So my goal is to help people out to really fix their issue, to actually be a service to people, and not be like the rest of what we have here in society today, which is greedy, money-driven people that unfortunately do not help people, but rather hurt people. Okay, that's what we have been dealing with here. So, like I said, everything that I said here was not medical advice. Always speak to your healthcare professional before starting any supplement or nutritional protocol or dietary protocol. Everything I say is theoretical. But if you want the real information, you can always message me here or on other platforms such as X or Twitter. Is the best platform to message me at if you want unraw filtered information on health and overall vitality. So hopefully this is informal for you. And if you want more info, just send me a text. Have a blessed rest of your day.